Uh, we will cover the embryology of the eye. We will cover the embryology of the eye in this video, in this short video. First, to understand the embryology, we have to understand the structure of the eye as we see. This white structure of the eyeball is the sclera. This grayish structure or brownish in the Asian population is the iris. This blackish is the pupil, and we have a transparent covering over this iris as a cornea. Between the iris and the cornea there is an interior chamber. This is the cut sac. This is the eyelids which protect the eyeball from any external injury or the foreign bodies. This is a cut section. This is a sagittal section of the eyeball in which we see the lens, iris holding the lens, the ciliary body, the zonules holding the lens, the cornea, the anterior chamber between the cornea and the lens and the iris. This neurosensory layer which sends the light signals, which converts the light energy into the electrical energy and sends to the brain via the optic nerve, is the retina. Between the retina and the outer layer, that is the sclera, is a choroid, this brownish part. And choroid, the ciliary body and the iris together are known as the uvea. This is the portion of the lacrimal caruncle. Lacrimal caruncle, here the punctum is present, the upper punctum and the lower punctum about 5 mm from the medial canthus. This area is the medial canthus. This is the lateral canthus. Okay, this is the gross anatomy. And in the retina, the maximum, having the maximum sensitivity, the area having the maximum sensitivity is the macula, and the central portion of this macula is the fovea. Okay. This we have studied in our anatomy lecture. In our anatomy lectures in the embryology classes, that first fertilization, on the first day of fertilization, the pronuclei are formed, the polar body can be seen. Then then mitosis occurs, and this changes into various stages. We have to remember that at day 7 there is the implantation. The most important point in this is the implantation at day 7 in the uterus. After that, the implantation of this fertilized egg, it changes into various layers, and by week 2 it changes into a bilaminar portion, and at week 3, that is 21 days, it changes into a trilaminar layer. This bilaminar layer, this bilaminar disc formation changes into a trilaminar disc formation at week 3. Bilaminar disc formation, the upper cells change into, and the lower cells change into endoderm, and the upper cells change into ectoderm. Okay, and these are the amniotic and the yolk sac cavity. And we remember that ontogeny recapitulates phylogeny, and hence we also come from various stages into the human form. We also first change into the amphibian form and then turn into the human form, and at some stage in the embryology we are in the amphibian fish form, the amphibian form, the forebrain, hindbrain, hindbrain, just as in the fishes it's seen. When it is a when it is a bilayered, this stage, bilaminar disc, is seen. If we cut the cross section, we get the ectoderm above and the endoderm below this. At about 3 weeks, this ectoderm differentiates into a neuroectoderm and a non-neural ectoderm with the neural plate border in between. This neuroectoderm starts to pick inside towards the endoderm, starts to pick inside towards the endoderm and later on forms the notochord. After separating from the surface ectoderm, they form the notochord. Okay, the para-axial mesoderm, the mesoderm, which is also the mesoderm, which is below the ectoderm, the para-axial mesoderm, which is around the axis of the notochord. It differentiates into various somites, notochord, and some cells also as a neural crest cells. Okay, so the neural crest cells and the mesoderm is together known as mesenchyme. So all these derivatives are from the mesenchyme. The I derivatives mostly are from the mesenchyme and few are from the neuroectoderm. This is a cross section of this This is the cross section of this amphibian fish. If we cross sect this fish, we see this picture. And the brain can be divided into telencephalon, diencephalon, and the midbrain part. And as such, it will develop further. We have to remember at 28 days, we are like a fish, the tadpole type of variety with a forebrain, diencephalon, midbrain. Okay, if we cut the forebrain section, okay, if we cut the forebrain section, you can see the green line. It is cutting that section. If we cut the section, what we see inside is this portion. The forebrain is divided. From the forebrain, there is an outpouching of an optic vesicle, and this outpouching of the optic vesicle, where it joins the ectoderm. This is the outpouching, the optic vesicle, and this is the surface ectoderm. The surface ectoderm thickens here and is then known as a lens placode. Okay, and this is the optic vesicle. This is the outpouching from the forebrain towards the surface vesicle. This is the outpouching. This is the surface ectoderm, which has thickened out. This is the lens placode, and this is the optic vesicle. Okay. At about 30 days, the same section, when we see the optic vesicle, which has come here, also starts to proliferate. The endoderm, which has reached this, the mesenchyme, which has reached this portion, starts to proliferate, and the surface ectoderm also starts to pick out. Okay. After a few days, at about 37 days, if you cut this section, the optic vesicle turns into an optic stalk, and this optic vesicle starts to inpouch. Okay, it starts to inpouch, come in, and its outer layer also starts to pull back. When it starts to pull back, the surface ectoderm also pulls back in the form of a vesicle. So this is the lens vesicle formation, and this is the formation of the optic cup with two layers. Okay, with the formation of the optic cup, this cup, which is formed, part of the inner vascular layer of the mesenchyme is also carried into the cup. It is not just that this optic cup is formed. The mesenchyme here also starts to come in between these two portions through the choroidal fissure, and this choroidal fissure starts to close, and the portion of the mesenchyme which has made its way into the eye is cut off from the surrounding mesenchyme. And what does this mesenchyme give rise to? It gives rise to the hyaloid system of vessels. The vascular mesenchyme, the portion of the mesenchyme that is a vascular mesenchyme, grows into this fissure and takes with it the hyaloid artery. The fibrous layer of the mesenchyme surrounding the interior optic cup. The fibrous layer of the mesenchyme surrounding the interior part of the optic cup forms the cornea. In the posterior part of the cup, In the posterior, here is the interior part which forms the cornea. In the posterior part of the cup, the mesenchyme which is there, the fibrous mesenchyme forms the sclera and the extraocular muscles, while the vascular part of this mesenchyme forms the choroid and the ciliary body. Okay. Now the corresponding vascular layer of the mesenchyme. The corresponding vascular layer of the mesenchyme here. The fibrous layer of the mesenchyme here forms the cornea. The vascular layer of the mesenchyme here, what does it form? It forms the iridopupillary membrane, which in the peripheral region attaches to the interior part of the optic cup to form the iris. And the central part of this lamina is the pupillary membrane, which also forms the tunica vasculosa lentis. So this is a lens development in just one picture, where initially the lens placard is formed, then the lens placard turns into a pit and pushes, this optic vesicle pushes the lens placard in, and this forms the lens vesicle. Then the optic cup vascular mesenchyme invades between the lens vesicle and the optic cup, and after a few the lens cells are formed. The fibers are laid down in the lens vesicle and the lens development is complete. Also in the lens development, in the initial layer, initially there is a cuboidal epithelium in the interior side just behind the capsule, and in the posterior there is no cuboidal epithelium. This cuboidal epithelium at the equator lays down various differentiating lens fibers. When the differentiating lens fibers are laid down, it slowly denucleates and there is loss of organelles. And with time and with passage, there is an increased angle of refraction because of the arrangement of the fibers, and there is a very clear mature fiber lens fiber is formed at the end. What are the secondary lens fibers? Primary lens fibers have already been laid down. What are now the secondary lens fibers? Secondary lens fibers are formed at the equator. Secondary lens fibers are formed at the equator from interior epithelial cells, and these remain active throughout the life. Since the secondary lens fibers are laid down concentrically, see, these are being laid down concentrically. It is pushing the nucleus inside. The lens on the section has a laminated appearance. The fetal nucleus is seen at the 3rd to the 8th month of gestation. The infantile nucleus in the last weeks of the fetal life up to the puberty, and the adult nucleus is being laid down after the puberty, and the cortex has superficial lens fibers of the adult cells. When we come to the development of the cornea, we already saw that the mesenchyme invades the front of the lens vesicle. The fibrous mesenchyme is responsible for the formation of the cornea, and the fibrous mesenchyme is responsible for the formation of the iridopupillary membrane. So this is the hair mesenchyme, and mesenchyme has started to invade between the lens vesicle and the surface ectoderm, and hence it is the mesenchyme is laid down, and the interior layer of the mesenchyme and the surface ectoderm changes into the corneal epithelium at that part. Okay. The endothelium is being laid down by this mesenchyme, and the cornea differentiates into the primary stroma. This primary stroma later differentiates into the endoderm, and between the primary stroma and that epithelium, between the primary stroma and the epithelium is laid down the secondary stroma, and the primary stroma is converted into the endothelial layer. Okay, it is clear now. The primary stroma is converted into the endothelial layer, and the primary stroma, which is responsible for the formation of the secondary stroma differentiates into the stroma. The epithelium is formed from the surface ectoderm. Okay, this is the development of the corneal portion, which develops from the fibrous mesenchyme. Next is the formation of the vitreous, which we will discuss in the next video.